outside. And what you're seeing right here, this is a map from the CDC of their weekly area where influenza or the flu is a big problem. I'm going to hit play. Brown is no good. Means it's a national epidemic. As I zoom in, this shows you from basically week 40 of last year to where we are right now in 2018, just how quickly the flu virus spread. As we tossed over to Catherine right now, you have some tips on what to do to avoid it happening in your household.
Yes, and Chief Medical Officer at the Fort Hamilton Hospital, Dr. Marcus Romanello, is here to kind of take us through this. And let's start with the flu vaccine itself. People I just saw on Facebook yesterday, people are like, oh, I could get flu from the vaccine. There's no excuse really not to get that vaccine,
Absolutely
right?
none. And for everyone out there who has not received the vaccine, I encourage you to still go out and get it. There's still time for it to be effective at increasing your immune response to the flu. The flu virus itself is always mutating, and so every year it's a little bit of a moving target to determine which virus, which particular strain will be present.
And so basically what you're saying is like the flu virus that may have been very effective at the beginning of the season, if the flu itself has changed, that vaccine may not have.
This particular strain seems to have some increased virulence compared to other strains, particularly for small children, as we've seen several deaths. Annually, anywhere from 5,000 to 50,000 people die across the United States from the flu or its complications, and we're still hoping to head those off.
And we know, you know, the typical wash your hands, you know, cover your mouth when you sneeze and those sorts of things. You've got 4 kids at home. Everybody's got the flu vaccine. What can you tell us as a doctor and as a dad to get us through this season?
Absolutely. Try and avoid getting yourself in a weakened situation. So making sure you're eating right, exercise, great sleep, focus on those to keep your body healthy, and then of course get the vaccine. Avoid the sick environment. So if you know you're going to a family gathering and Aunt Betty's out with the flu, yeah, try and avoid those situations.
Because you're saying even the staff at your hospital have almost 100% vaccinations and still some are getting sick.
Yeah, we have a couple nurses who were out sick last week, and it did limit our ability to care for the full number of patients we could have occupied in our hospital, but we've since recovered and we're back up to full capacity.
All right, Dr. Romanello, thank you very much. Chris.